There are 4 sites we can use for intramuscular or IM injections, though 3 of them are the most common. The dorsogluteal is rarely used due to its high risk of damaging the sciatic nerve. The other 3 sites are the vastus lateralis, found in the middle third of the lateral aspect of the thigh, the ventrogluteal on the outside of the hip, and the deltoid muscle in the upper arm. Let's look at these sites in detail. To locate the vastus lateralis, visually divide the thigh into thirds vertically and draw a line directly down the front. You will inject in the lateral aspect of the middle third section. To locate the ventrogluteal, place the palm of your hand over the greater trochanter with your middle index finger pointing at the iliac crest and the index finger toward the anterior superior iliac spine. Both of these sites can take up to 3 mils of medication with a 1 to 1.5 inch needle, depending on the size of your patient. The injection site for the deltoid muscle is 2.5 centimeters or 3 fingers below the edge of the acromion process. For this site, use a 1 mil of medication and a 1 inch needle. This site has the most variance based on the size of the patient. A very large patient can handle 2 mils and a 1.5 inch needle. However, a very small, frail patient would require a 5/8 inch needle and no more than 1 mil injection. And remember, intramuscular injections should be administered at a 90-degree angle with a gentle, dart-like motion.